there's a pretty good chance your kids have been treated at some point in their lives by a pediatrician from the University of Louisville. Dr. Gerard Rabalais is the chairman of UofL Pediatrics, and he's here to talk about a whole host of things, including a new building, research on children's health, UofL's relationship with the Children's Hospital, and some of the new health concerns that are impacting kids. Dr. Rabalais, welcome.
Hi, Mark.
Good to see you again.
Good to be here.
Good to have you. All right, let's talk a little bit about the big news, I guess, coming out of pediatrics is this brand new building you're getting ready to start on, at least, right? So tell us a little bit about that.
That's right, Mark. This building is the culmination of years of planning. It'll finally put together in one place, in one building, all of the pediatric medical and surgical specialty physicians that take care of the vast majority of children with these kind of problems from across the state.
And where will this building be?
The building is downtown on the Health Sciences campus. It's on in the quadrant related to Preston and Chestnut Street, where the adult outpatient care building is set right behind that.
So right in downtown on the whole Health Sciences campus, right?
Yeah, just a block and a half from the Children's Hospital.
Okay. Well, let's, you said, and everything that's related to pediatrics is going to be in there. So if I've got a child that's seeing a UofL pediatrician, chances are that's where I'm going to be going to take my kid to the doctor's office?
That's right. We'll have a general pediatrics presence down there in addition to every specialty, medical and surgical. So the real advantage of this building is that if your child needed more than one doctor, and many children with chronic illnesses need a heart doctor and a lung doctor and an infectious disease doctor, for the first time ever, they'll all be in the same building.
Why do you need it? Is that just the idea here is to put everybody in the same building that's related to pediatrics and UofL?
Well, it's in part for convenience for the patients and families. Right now, these parents might have to travel to 2 or 3 different buildings around the Health Sciences campus to get seen by those 3 or 4 different kind of doctors. The other thing it allows us to do is it allows us to put together clinics that have multiple specialists in the same physical clinic around a specific condition. So there might be children with a genetic disorder that need 3 or 4 different kind of doctors, and now they're all in the same room where they come to you.
Okay, and so this building's going to be built when? What are we talking about?
Well, the hole's in the ground, and
did you dig it yourself?
No, sir.
You got there with a shovel?
It's
no,
best if I don't try to do that. It'll be finished in June of 2018.
And that will be, let's see, almost 2 years from now.
That's right.
So we're talking. And where are the offices right now? If my kid's going to a UofL pediatric person, or need to see a specialist in pediatrics, where do I go now?
Right now, downtown, they're in the Gray Street Medical Building. They're in the Children's Hospital Foundation Building. We have specialty offices out on the East End, out at the old Brownsboro campus. Those will stay in place. So we're capturing all of our downtown capacity and putting it all in one building.
We're talking with Dr. Gerard Rabalais, who's the head of pediatrics at the University of Louisville. You know, I don't think a lot of folks understand that UofL pediatricians are everywhere. So kind of give us an update about how many pediatric doctors UofL has in this community, and how many kids, if you know, how many kids you see each year.
Sure. We have well over 200 medical and surgical pediatric specialists that work for the University of Louisville, and much of our work is in downtown Louisville, but we have satellite clinics that really go from Ashland to Paducah, and we have literally a couple dozen sites where physicians that are heart doctors or lung doctors or kidney doctors are going to be out there seeing children nearer to their hometown all across the state.
And these are specialists, or are these just family pediatricians?
No, these are specialty trained pediatric physicians.
And they're all over the state.
Yeah, we have them. We have people on the road every day of the week.
And why is that? What was the idea behind that?
Well, the rationale is to first provide service that's closer to where the patients live, because for you to be able to come from Paducah to Louisville to get care every 6 months, if you had a child with a heart condition, for example, is a huge burden for the family. And so it allows us to provide care closer to where they live. And it also provides the ability for us to make sure that an appropriate number of referrals come into our medical center, because there are certain kind of programs that you just can't run on what's in a city like the Louisville size on its own. So our heart program, for example, is entirely dependent on a statewide network of referrals.
And does that give UofL kind of a moniker of more of a statewide institution when you've got your doctors all over the state?
Well, I think so.
And I assume that's a good thing.
That is a good thing. Yeah, I think it's a good thing.
I think so, too. Let's talk a little bit about the relationship with Norton, too. There was a little bit of hubbub about the relationship between the University of Louisville and Norton. Where are we now in that relationship with the Children's Hospital and Norton Healthcare?
Well, as of December last year, we signed an affiliation agreement for the next 8 years with Norton Healthcare around pediatric services. This guaranteed a significant level of funding, over $30 million a year in funding to support a variety of things: residency programs, research, clinical program development. And we meet every month. The University of Louisville representatives and Norton meet monthly in a very collegial environment. We're even working on things, Mark, that go beyond the letter of the agreement at this point.
Such as?
Oh, we're working on things where we're trying to put our specialists together, because Norton employs some specialty doctors, and we have the comparable specialists, and we're trying to find ways to have them work together in a more effective way.
We're talking with Dr. Gerry Rabalais, who's head of pediatrics at the University of Louisville. So do you think folks understand that when they go to what's now called the Children's Hospital, Norton Children's Hospital, that the person who's probably going to walk in the room if they have an emergency situation with their child is probably a UofL doctor, a UofL pediatrician?
That is true, but I think most people don't understand that.
Why is that?
I don't know, but about 80% of all the care that's delivered at the Children's Hospital is delivered by a University of Louisville faculty member.
And I don't think anybody has a clue that happens. Do you think it's just a confusion, perhaps, that you're going to a Norton hospital, but it's a University of Louisville person, and that people just don't get that? There's just confusion over it?
I think so, Mark, because it is a Norton facility, and it'll be even more clearly identified as a Norton Children's Hospital going forward. But this relationship has been there for decades. It's not new. We've always had this relationship and had an affiliation agreement that ties us together. We've never owned the Children's Hospital as the university, and we've always partnered with whoever owned the Children's Hospital facility.
We're talking with Dr. Gerry Rabalais, who's head of pediatrics at the University of Louisville. Let's talk a little bit about child care. Are there some things out there that you are seeing or pediatricians are seeing that perhaps they didn't see 10, 15 years ago in children? Other than obesity, everybody's heard about that one, that kids are getting fatter. But other than that, is there anything else that's running out there?
I think a lot of what the pediatricians are seeing are the behavioral mental health problems that are becoming a bigger and bigger problem for them to deal with. And as immunizations have gotten more effective at preventing infectious diseases, that was something that's really 15, 20 years ago, the pediatricians spent a lot of time dealing with. Now, attention deficit disorders and behavioral disorders are the things that are occupying 20, 30, 40% of their day. And it's something that they've not historically been well trained to deal with. And so we're very mindful of that in our residency program to make sure that our new graduates are very well prepared for dealing with those kind of problems in children with autism-related disorders, because it's a very difficult set of problems to deal with. It's not something you do in 10 minutes in an office visit, and the need for social workers and psychology working together with general pediatricians is more great than ever.
And it's very collaborative, which I assume the University of Louisville has a number of folks that work with the pediatricians on those types of issues.
Yes,
right?
That's right. The University of Louisville has an autism center, and we have a large evaluation center at the Weisskopf Center that helps to sort out how to best deal with these kind of problems and to help inform pediatricians about what kind of care, what kind of medications, what kind of counseling is best used to serve these children.
Well, you're a doctor. Why do you think that is? Why do you think we've seen this rise? Is it just we're becoming more aware of these children with these behavioral problems, or are they actually having more kids with behavioral problems?
But I think it's a mix of both. Certainly we are seeing a greater recognition of these problems. We're better at picking up autism earlier. We're better at understanding the nuances of what you might have labeled as a sort of a difficult child. Now they might have a more specific diagnosis, and perhaps some counseling or medication intervention could help.
And your folks in pediatrics at the University of Louisville are not just treating patients and treating kids, they're also doing research. So why don't you tell us about a research project that has just begun here that we heard about on this program a couple weeks ago, but why don't you give us a little background on it?
Sure. We're very excited to be part of this new network of clinical trials sites across the country, where the National Institute of Health has just put out well over $100 million to support research on the effect of the environment on a child's health outcome. And the real focus here is that if you can get a child to be healthy as they enter adulthood, then they're healthier adults. So if their asthma is better managed, or if they're less obese than they might have been, or if the prematurity was prevented through the mom's pregnancy, then boy, you delay a whole host of problems that could affect the child. And so it is research in that area that's been supported now by the National Institute of Health. This is a unit that was started over 15 years ago, run by Dr. Jan Sullivan. And this unit was originally funded by the Kosher Charities and physically lives inside the Children's Hospital at this point, but we're expanding it to the new medical office building, and we have other sites that we'll be doing as well. And this is a kind of service that will tie into an existing infrastructure that we already have and take advantage of now a statewide presence to help do a better job of understanding how the environment impacts child health outcomes.
We talked with Jan Sullivan and Sarah Watson, both doctors, as I said a couple of weeks ago. And one thing that I thought was interesting is they were talking, when we're talking about environment, we're not talking about just air pollution and water pollution and those kinds of things. We're also talking about their environment like cell phones and the impact of those kinds of things on kids as well, right?
Yeah, that's right. That's right. And even the social environment that the child comes up in. If your family, if your mom and dad are married or not married, if your mom and dad are sick or unable to get care, so their health impacts the ability of the child's health to be optimized.
And the idea, again, is to, if we can track down why kids are being unhealthy at an early age, that they will become or keep tabs on themselves as they become adults. Is that the whole idea?
That's a big part of it. The whole goal of pediatrics is about prevention. And if you've ever been to a pediatric office, you know they ask a bunch of questions about
yes,
seat belts and bike helmets and about gun safety and about did you get all your shots. And we're very attuned to prevention because we are able to, if we can get a child to age 18 in the best possible shape, then we've prevented a lot of adult morbidity. But boy, if they enter adulthood and they've already been to carry the baggage of some of these chronic diseases, then they really are it's going to be a bad outcome for them. It's going to cost more to manage their care. So from a public health standpoint, it's right for the kids, it's right for the family, it's right for the payers.
Before I let you go, Jerry, let me talk to you about, let me let you make a pitch for UofL Pediatrics. What would you tell folks who are listening that may have a child out there who may have some special need or some different kind of health problem that maybe they just haven't been able to find the right type of doctor? What would you tell them about UofL Pediatrics?
I would tell them that we have specialists that were trained in the very best places around the country. Our doctors come from the training programs that are the elite training programs all over this country, and they are top-notch people that are available right here so you don't have to travel to those places to get good care for your child.
Very good. Dr. Jerry Rabalais, the head of pediatrics at the University of Louisville, thanks for being on the program, and good luck with the new building.